Hello, this is Mr. Nolan from Graduation Alliance, health and fitness instructor, and I'm here to talk to you about drug and alcohol use, which is lesson 3.1 from Health Semester 1. Why do people smoke when they know it's bad for them? Nicotine's a highly addictive ingredient in tobacco. Tobacco stains your teeth, gives you bad breath. Tobacco causes cancer of the mouth and throat. Smoking causes increased risk of heart and lung disease, and smoking hinders breathing and increases the effects of asthma. And smoking causes dry, yellow skin and wrinkles. So even though individuals know that smoking is bad for them, we have enough research now that proves that it is highly addictive. So the biggest piece is the nicotine in tobacco products that is very addictive, and it is really difficult for people once they get hooked on it. Alcohol consumption, brain development continues throughout adolescence and into early childhood. Alcohol can damage areas of the brain that are still developing, such as areas that control judgment, feeling, decision making, and memory. So especially important that individuals going through adolescence, your brain is not fully mature till sometime in your early 20s. So any kind of chemicals that you're putting into your body can hinder the growth of your brain matter. The NIDA, which is the National Institute on Alcohol Abuse and Alcoholism, has some facts I'd like to share. Each year, approximately 5,000 young people under the age of 21 dies as a result of underage drinking. Some new preclinical research in rats has identified a link between adolescent alcohol exposure and specific molecular changes in the brain that contribute to increased anxiety in adulthood. So they've been doing some research and find that if adolescents are participating in consuming alcohol, that they have an increased chance of ending up with anxiety as an adult if they don't have it already. Binge drinking definition is the practice of consuming large quantities of alcohol in a single session. And this, for example, is if men drink 5 or more drinks, women drink 4 or more drinks in a 2-hour span, that is considered binge drinking. There are some serious risks that go along with binge drinking. One is unintentional injury, such as car crashes, falls, burns, alcohol poisoning, violence, including homicide, suicide, and sexual assault, fetal alcohol syndrome, which is if a mother is drinking during her pregnancy, the baby can be born with physical deformities, mental retardation, learning disorders, vision difficulties, and behavioral problems. Chronic diseases such as high blood pressure, stroke, heart disease, and liver disease, memory and learning problems, and also the possibility of alcohol dependence. This graph over here shows who binge drinks according to a survey in 2015. And as you can see from this chart, the largest population is ages 25 to 34. So we're looking at individuals that are just out of college, early starting in a career possibly. Also, we see college age students are rather high also. And then it tapers off as individuals get older. Drug use, what is marijuana and why is it bad for you? Marijuana is a commonly used term for the female cannabis plant, which is dried and smoked by many people as a psychotropic drug. Marijuana contains a psychoactive or mind-altering chemical called THC, which is short for delta-9 tetrahydrocannabinoids. Marijuana can impair judgment and reduce memory and coordination. Long-term marijuana smokers are more likely to experience depression or anxiety. Here are some facts from the CDC website, cdc.gov. The number of self-reported marijuana users is increasing. In 2014, there were 7,000 new users of marijuana per day. 13% of nighttime weekend drivers have marijuana in their system. This is up from 9% in 2007. After alcohol, marijuana is a drug most often linked to drugged driving. Other facts, 38% of high school students report having used marijuana in their life. Research shows that marijuana use can have permanent effects on the developing brain when use begins in adolescence, especially with regular or heavy use. Frequent or long-term marijuana use is linked to school dropout and lower educational achievement. Stimulants, which are a class of drugs that elevate mood, increase feelings of well-being, and increase energy and alertness. Stimulants cause a buildup of dopamine, which results in a feeling of intense pleasure and increased energy. But after taking high doses, users can experience intense paranoia or anxiety. Some short-term effects of the use of stimulants are, which can include exhaustion, apathy, depression, the down that follows the up. It is the immediate and lasting exhaustion that quickly leads a stimulant user to want the drug again. Soon they're not trying to get high, they're just trying to get well, to feel any energy at all. Long-term effects: stimulants can be addictive. Repeated high doses of some stimulants over a short period can lead to feelings of hostility or paranoia. Such doses may also result in dangerously high body temperatures and irregular heartbeat. According to the recent World Drug Report published by the United Nations Office on Drugs and Crime, amphetamine-derived stimulants like ecstasy and methamphetamines are the most commonly abused drugs around the world after marijuana. That is the end of the lesson. This information is going to help you for the lesson 3.1.1 activity. If you have any questions, reach out to your health and fitness instructor. Have a great day.